And in medicine in general, people always say you shouldn't go into it for the money. You should go into it because you want to help people. I mean, if you want to go and make a lot of money, you're picking the wrong field. I mean, you can have a comfortable living, but if you want to be rich, then there are many other things you can do that doesn't take you, 29, 30 years to complete.
Welcome back, everyone. You're listening to the Adam Nessum Show, and joining me today, we have Dr. Dustin Harris, who is an assistant professor of emergency medicine at the University of Texas Southwestern Medical Center. He graduated from UCLA Medical School, did his residency in emergency medicine at University of Chicago, and then went on to complete the Stanford O'Connor Sports Medicine Fellowship. He's also known to many on Instagram with over 20,000 followers, and also does some writing and comedy in his spare time. I saw on your Instagram bio. So thanks for joining me.
Great. Thanks for having me.
Awesome. So my first question to you, for those that don't know you, can you give us just a little bit of your background and kind of why you decided you wanted to go into medicine?
Yeah, sure. So I think I have one doctor in my family, my uncle. So didn't really have parents that were doctors or pushed me into medicine at all. I had decided before I even knew my uncle was a doctor, but I have a twin brother, and then I have a little sister. My sister is 8 years younger than me. So when she was born, I kind of remember her coming home from the hospital, and, I really wanted to help out and take care of her and, kind of be a good big brother. And I really like that feeling of caring for somebody. And, when you're a little kid, you want to be a firefighter, a cop, a doctor. Mm-hmm. And I chose doctor, and I'm very stubborn, and I never changed my mind. But I always thought I wanted to do pediatrics. That was actually what I would say. And people ask me what I wanted to be when I became a doctor. But then I got to medical school, and I worked in a pediatrics clinic or shadowed, and just wasn't what I was looking for. I can tell you how I got into EM too.
I was just about, so you're leading me into my next question, which is, how did you decide to go into emergency medicine? And then also, did you always plan on doing that sports medicine fellowship?
Yeah, it's a few stories. So pediatrics, I was in the clinic, and I was like, wow, this is very boring. And I think it was mainly just being in a clinic, 9 to 5. Patients are coming in with, aches and pains. So I was like, I need to go back to square one and try and find a different specialty. So when I was in college, I took a Myers-Briggs test. For anybody out there, I'm an ENFJ. And if you Google your Myers-Briggs and ask what doctor should I be, something will come up with a list for you. And I just wanted some sort of guidance.
I should probably go do that after this.
So then I think the first three the first one was cardiothoracic surgery. I remember that being number one. And then ophthalmology, and then emergency medicine. So I went to cardiothoracic surgery, and the first surgery was 14 hours. And I was like a first year med student. I was behind an attending, a fellow. So then I chose EM. I picked a mentor. She had me come on a Friday overnight shift at a county hospital. And I mean, the first thing I noticed that the people were really welcoming. Our personalities kind of vibe, we gelled together, which I think is a really important thing for anyone choosing a specialty. You got to look at the personalities of the people, because that's what you're going to be working with every day. So there was a Friday overnight, and they said a GSW is coming in. And I was like, oh, what's a GSW? And they're like, gunshot wound. And I was like, oh, geez. And so everyone got gowned up, stood around the trauma bay, and they had me stand in kind of the corner, like near the patient where his shoulder would be. The patient came in, penetrating trauma to the chest. And I'm sure Adam knows this, but anyone with penetrating trauma to the chest with no pulse gets a thoracotomy. So thora meaning your thoracic cavity or your chest, and otomy meaning cut. So we cut through between the ribs, we spread it open to expose the heart. And the point of that is to find something you can fix: a hole in the heart, blood around the heart, injury to the aorta, a punctured lung, anything like that, anything to try and restore a pulse. I didn't know any of this at the time. I was just standing there in awe, seeing a heart in front of me. And my mentor, who I just met that night, was like, all right, medical student. I didn't have a name at that time. put your hands around the heart. And she's like, go
Wow.
like this. And I did that. And then I took these little defibrillator pads and put it on the heart and shocked the heart. And I think after 2 shocks, the patient regained a pulse and then went to surgery. And I was like, this is incredible. And I look back at it like kind of like serendipity, because I never saw thoracotomy again until my residency. So, I mean, because they're not that common, and especially for someone to come back, like some stats say 1%, some say up to 7% if you do it correctly. But again, you can't just like go into something for all the awesomeness you're going to see. You gotta like the bad stuff too, and you gotta like the people. So then I really liked EM. So then sports came along. It's not going to sugarcoat it. EM has a high burnout rate. And so I wanted to kind of vary up my practice. And so I looked at the tons of fellowships available in emergency medicine. And sports really stood out to me because I did track and cross country in college, did sports throughout high school. And for just 1 extra year, I could do a whole different specialty. So if I didn't want to do emergency medicine anymore, whether that's now or in 20 years, I could just do sports if I wanted to, which is a nice option for me. Right now, it's just kind of a thing that makes me more unique in my practice. And also I get to work in clinic as well as work in the emergency room. So it's pretty cool.
Got it. So right now, no, I appreciate you sharing that. And that's a pretty cool story of that early on, getting that type of exposure in EM. So right now you're not actually working within sports or have certain plans of doing sort of dual practice, or that's more of a down the line to...
My department's working on it. So we're meeting so when I interviewed, the sports department also kind of hired me, and they said, yes, we're going to have you work in a clinic as well. This month was kind of like a trial by fire kind of month, and now that's over. I'm now starting to work more towards. So the goal is to have 1 day a week of clinic and have that day be blocked off in all my EM schedules, and then work the EM around it. And then this program actually works with a couple different teams. So if COVID wasn't happening, we'd be working with them. But once they come back, like probably next year, I'll be doing some game coverage as well for some professional teams.
That's pretty cool. Just selfishly, because I'm very interested in sports medicine, how is that fellowship like?
That specific one, or doing sports medicine in general?
Well, either or, but like the one that when you were doing your sports fellowship, how was that? Like, I know we talked off air a little, and you were saying you were doing shifts as well. And
yeah. So my, I think overall that was a great fellowship. For sports, I learned a lot, and it had everything that I wanted. It had college coverage, and I got to, work with my own high school team. We did lots of clinic. It's been around since like the 80s, maybe early 90s. So it's very well known, and they have a huge alumni base. And you have access to all of Stanford's facilities and all that stuff. It's just Stanford is kind of weird about their fellows work, because I was a 3-year residency and Stanford's a 4-year residency. So my ER time was not what I wanted. So I looked outside to pick up shifts on my own. And it's a normal 9-to-5 type of fellowship, because that's how sports medicine clinic is. It's just 9 to 5. So your weekends are usually off, but you do have game coverage. So, I mean, it wasn't like I was breaking duty hours or anything. So it was fine. It was, I would definitely pick that one again. It was great. I liked it, but I did have to work on my own for the ER part of it, which isn't really their fault. It's just the policy.
Gotcha. And how, when you were making that decision, because I know there's like kind of different routes you could do. You were mentioning in terms of sports medicine fellowships where you were weighing, where you're kind of getting paid as a resident versus a fellow or attending level. How did you kind of factor that in?
Right. So the most sports medicine fellowships, because they are ACGME accredited, pay you like a resident. But some have it factored in that your ER time is kind of, some places have like a community ER component already built in. Gotcha. And you kind of get like a stipend or a salary on top of that, or salary bump. but most places allow you to work on the side and pick up shifts to make extra money. I think just in general, picking a fellowship versus me, because I had some people who graduated from my residency making having offers for high 400s, 500,000 a year immediately after residency, and me saying no to that to make, still 5 figures. Is a big decision, but I think I like to think in the long term and think in the future. And, I'm I think I'll be much happier if I just take this one extra year to, broaden my knowledge base.
Got it. Yeah, I think that makes sense. And for any students listening, you sometimes have to, as hard as it is, because it's such a long process to begin with, thinking long-term is always a good thing.
Yeah. And in medicine in general, people always say you shouldn't go into it for the money. You should go into it because you want to help people. I mean, if you want to go and make a lot of money, you're picking the wrong field. I mean, you can have a comfortable living, but if you want to be rich, then there are many other things you can do that doesn't take you, 29, 30 years to complete.
Yeah, absolutely. I think if you do the financial breakdown on being a physician, especially today with the debt, it's not as, it definitely would make sense not to go into it just for the money. I would completely agree. So what is your day-to-day like now as a practicing physician?
My life is very good. Once you're done with all your tests, life is nice. So my current contract is for 14 days a month. So average 3-4 days a week of ER work. My goal, like I was saying earlier, is to factor in 1 day of clinic, and then I would buy down my ER shifts. So I would either drop down to 10 shifts or 12 shifts a month. My goal being working at most 4 days a week. But there are other aspects because I work in the academic system. You kind of pay for having the benefits of working at a great hospital with all the specialties at all hours of the night, as well as occasionally working with residents and teaching them. So you have to kind of offer something back and, provide scholarly work. So so on my days off, I have a couple of research projects that I'm trying to get off the ground. Some I feel very interesting. And then I think they want a sports medicine fellowship here, and I'm trying to get the pieces together for that as we move forward. But in general, it's I work on the days I work, and then when I'm off, I'm pretty much off. It's my own time, but I choose to do some research. I don't have to. There are other ways I can contribute, but I just have these projects that I think will be very interesting to the different communities that I'm involved in. And then something else came to my mind that I forgot. There's a lot of meetings that you can attend. I can go to residency conference. So when you finish all your tests, you do have to continue doing CME or continuing medical education. It's not a lot, but you just have to stay on top of it. So me going to resident conference and listening to the lectures, that counts as my continuing medical education. I don't have to go to every conference. I have to go to 8 a year or something, and it's every week. So it's very manageable.
Not too bad.
Yeah, sometimes I'll listen to, if you're in emergency medicine, a podcast called MRAP, Emergency Medicine Reviews and Perspectives, and they go over all the most recent literature. I have another literature EM podcast I listen to sometimes. And then this is just right now, but I have a sports medicine conference that was canceled in April that I just held virtually. But I was working when they were holding it, but everything was recorded. So I'm going to probably watch that
and get the credits for it. Makes sense.
Yeah. But, I'm going to Austin next week, and I visited my parents a few weeks ago to before, if everything got worse, hopefully it doesn't, but, just to say hi to them, because I got my holiday schedule and I probably won't be going home for Christmas this year.
Oh man.
It's fine. I mean, I am off, but it'll be hard. I think it's more the safety. I probably won't go visit.
Makes sense.
Yeah. Life, this is how nice the life is. Next week I work 1 day. So it's a pretty nice life.
You gotta plan something fun then. You got anything planned?
Some friends are in town. Yeah.
It's fun. So in terms of, it seems like right now you're in academia, potentially getting involved in a sports medicine fellowship program that I don't know if you'd be part of I'm sure a part of teaching that. How do you think in terms of your career, do you plan on staying in academia? Did you ever think of that versus like private practice?
So if you asked me last year, I would have been like, yeah, I want to work in academics. I don't really want to work in anything else. I think I'm just open to where my career takes me. I think if I get more and more, like if I were to just love sports and like really want to like work with the NBA or the NFL and like be like an executive or something, I think I would have to move towards community emergency medicine because that's less of a commitment. I can just pick up shifts here and there.
Got it.
So right now it's like, no, I want to be in academics. I like teaching. This job pays well. I'm not working terribly hard. I mean, I work hard when I'm at work, but they don't have a whole ton of requirements. Everyone's super nice. The city's great. But I really have no idea where my career is going to take me. So I'm really open to anything and everything. But I could see myself if I was to be like an actual team physician for a professional team, which is like a full-time job and you're like on call and stuff.
Right.
Then I would still want to keep my emergency medicine skills up. So I'd probably just pick up shifts in the community. One, because there's less commitment, and two, because they probably pay a little bit better than an academic, like picking up shifts in an academic place.
Right. That makes sense. And if you can't have if you're like doing that, then you can't be fully committed to an academic position like you are.
And I think if I was working in a community, it'd be more challenging too. Because if I was to pick up a shift and the resident was doing all the work in an academic center, it's fine. But I'd probably be like kind of rusty. So I'd want to, get my hands dirty again.
Right. That makes sense. Interesting. So I did see, like, the way I found you was through social media, which is interesting that I'm able to connect with people in different specialties and fields within medicine that I'm interested in. And I know you said you're much less active now, but what was, I guess, your inspiration, or how did that come to be where you grew this following there? And have you leveraged it at all in regards to your career?
In regards to my career, no. Haven't really. If I was to have accepted a community job, I probably would still be very active on social media and try to. I mean, I never had a goal for it. I kind of did it and I wanted to see what opportunities presented themselves, and several did. And then eventually I was like, well, is this really worth the time I'm putting in versus the actual full-time job that I have?
Right.
And now it's like,
probably pays a little like better.
Exactly. So, I think I was, I was a second year resident. I kind of remember this conversation very vividly, but I was dating someone and she brought up some Instagram doctor or somebody, and I looked at them, saw their following, and I was like, I could do that. Like, what's so hard about that? It was a lot of fun because I kind of I don't know if I was really that unique in my posts and stuff, but I feel like I tried to be, where I was like, a little bit more comedy, some poetry and some like educational stuff, but still kind of funny. A little bit of inspiration. It's like it was maybe kind of too much all over the place, but like I felt like it had something for everyone. So yeah, I just posted regularly every day, and I guess I found my niche. So actually, this is almost nobody knows this. Well, 25,000 people might know it, but so when I was a med student, I made like a meme Tumblr. And so this is third year of med school. And I was like, it was mainly probably during surgery. I would just sit in the surgeries and think of like memes or something. And then I would go home and I would post them. But I was completely anonymous. Like no one ever knew who I was. And I had like 25,000 followers. And then I was like, well, no one knows who I am. I did it for fun. I kind of want something out of it, and like Tumblr is not going to pay you or anything like that. So I was like, well, let me see if I can do it on Instagram. So then I was like well, these people have followings. Like, why can't I have one? So I just posted regularly, and I kept posting. And then, yeah, it kind of just blew up. And I met other influencers, and we partnered together. And then, some scrub like the very, 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 very first person to reach out to me was a scrub company from Korea or something. And I was like scared, because I was like, oh man, is it real? Are they going to like send me something what if I don't like it? And so I kind of just never responded to them. They might be listening right now, but it was so long ago. But it's mainly, so I didn't know what I was going to get out of it, but I got like, a lot of friends, people that I've met in person now. Free stuff, but who cares? And then I just have like a ton of like funny stories, like some like reality shows reaching out to me, or like,
are you secretly going to be the next Bachelor? Is that what we're looking at?
you caught me. That was one of the shows, but anyways, there was some really, really funny there's one really interesting show that I'm thinking about, but it was just like kind of like a little experiment. And now I like, educating people. Now it's more mainly to make myself laugh and make other people laugh. So like people are like,
did you go on a show?
No, I just like, I like had people pitch them to me, and some were like really interesting ideas. But people now like I'll like go on a date and they'll see how many followers I have, and they're like, oh my God, you're famous. And it's like, this is something I say a lot to people. I say, your follower count does not make you a good doctor.
That's definitely true.
And I'll take that to heart. Like, I have tons of followers. Well, not as many as some people, but I think I have a lot. And I mean, I think I'm a good doctor. I want to be a better doctor, but I don't think that means anything. It means nothing to my medicine career. So,
for sure. Yeah. I
might leverage it to if I have to build my sports clinic up, I might leverage it in that way.
Yeah. I think that's
what I'm keeping it around. Yeah.
Kind of alluding
that's
to.
That's one way I can see myself using it. I didn't think of that initially, but as I moved on, that's something that I thought about. Yeah.
Right. Yeah, that makes sense. Yeah. I feel like sometimes social media is definitely a double-edged sword, and it's made some interesting stories, great connections. Definitely for me, even as a med student, it's opened up a lot of opportunities, but at the same time, you always have to be like wary of what might happen. And
I've heard stories, people getting burned and stuff. And then someone actually today posted a photo on their account, and I remember a nurse posting almost the exact same
similar
and getting fired. So I like had to message them and be like, hey, you need to be really careful posting stuff like that, because if someone found it was like a really terrible story what happens to the nurse who got fired, but it's easy to make a mistake like that. That's why I like never take a picture in the hospital, because never. But people post patient stuff, and I don't know how they get those. I mean, you could sign something, but I feel like a patient could still get mad about what you post.
Yeah, I never understand when you see like sometimes very
people
gruesome
doing surgeries and stuff, and I don't know. I can't cast the first stone. I'm like, I don't feel comfortable doing some things, and I usually just post about myself, or like funny stuff that I think is funny and it makes myself laugh. But now it's just kind of there.
Interesting.
Well, we'll say like this.
Yeah, exactly. You get reached out to by random medical students to be on their podcast. Again, appreciate you taking the time. What was I going to ask you? So in terms of outside of medicine, have you found that you've been able to do a lot more? Like, what hobbies do you enjoy doing now that you have some more free time as an attending?
Yeah, I'm actually in the hobby market, but things that I've dropped and now have picked back up. I mean, I love working out, so I work out a ton, like hopefully every day. But then I am learning to cook more. So my dad he is the cook in my family. So I've always been kind of sad that I don't have better cooking skills. I mean, I can cook, but I kind of only know how to make like 5 things. So I've been really trying to push myself to cook more. I bought a couple of cookbooks and I've been picking up cooking. I might start buying one of those food delivery services, but you're still
so you can cook it with the I tried doing that in med school, but I got too stressed because if I either messed it up or I feel like I didn't have enough time, I was like, I'm just going to order something.
Yeah. When you're attending,
eat something up.
You could probably get back into it. Yeah. No, residency and med school is definitely a, heat up frozen stuff kind of time. But then my friend asked me today to go rock climbing. So that might be a new hobby that I'm going to start picking up.
Ooh, interesting.
For some reason, a lot of ER doctors like rock climbing. So, and I used to do it when I was a kid and I loved it. So I might get back into that. But if COVID was around, I would, with all these free time, I would probably travel more. And then I have like tons of books that I need to read or would like to read. So every night I just read for an hour or so. But yeah, not having the requirement to go home and study every night, it's a blessing.
That's the big difference, I feel like, because even sometimes when school's not too hectic, it's always but there's always something you could be doing looming over your head. There's
always a test. There's always a research project, always. So yeah, I totally agree.
On that note, what are your research projects within emergency medicine or sports medicine?
Both. So I may talk about them briefly. So the first one, I'll talk about them in the order would like to do them. So the first one that's the most fleshed out is just an easy survey study. So this is only sports. So this is like the perceptions of trans athletes in sports medicine. I just feel like there's not a lot of transgender education or focus in the every athlete gets a pre-participation exam, and I feel like there should be more, I guess again, focus on the transgender athlete when they do approach you. Because I had a couple or two last year, and I know some things about transgender people, but from an athlete standpoint, I feel like I could know more. And I've done some research now, and there's a lot out there. And I felt like this would have been a huge year for the transgender community there, because they've been allowed in the Olympics since I think 2005. I don't think there have been any. There have been some in world championships, but none in the Olympics yet. So I thought maybe this would be the year, the way things are going, but maybe next year. So just gonna be a survey of sports medicine physicians and what their education has been.
Got it. So
do they feel comfortable
geared towards physicians?
Yeah, that one. Yeah. And then the next one, which I'm probably most excited about, is EM and technically sports, or EM and ortho. So you probably know this because you're a little bit interested in ortho, but whenever someone comes in with a swollen knee in the ER, you should tap it if they haven't been tapped before. Or for those people out there, you do an arthrocentesis, arthro meaning joint, centesis meaning, I think, to draw fluid. So you kind of stick a needle in the joint in the knee or the elbow or wherever, and you draw the fluid off, send it to the lab and test it.
Right.
So if you ultrasound the things you're worried about are the main things: arthritis, gout, or osteoarthritis, gout, septic arthritis, or pseudo gout or something like that. So you could just ultrasound the knee, and if they have gout, there's a sign that you can see that's 90% specific. Oh, so you could kind of say, oh yeah, I'm done. This is gout. You can be on your way. Mm-hmm. Or you could do that, tap them, discharge them, and treat it as gout, and they can come back if the result, because the time for the results to come back is kind of a little while. Right. So I would like to do that for a year, have every person who came in with a swollen knee get an ultrasound, but still get tapped, and run the numbers, and maybe create an ER. We love scores. So create a score, you see the sign, they have a uric acid level, they have a history of gout, don't tap them, stuff like that. I think that'd be cool. Actually make some difference. That's very interesting.
Yeah.
And the last one is the least kind of fleshed out. It's I kind of wrote an article about this before, but it's sports effects on gang violence. So you would think if you're a kid and more underserved area, with high crime rates, and you participate in sports, you're less likely to, join a gang or get shot.
Right.
The research is kind of conflicting. Sometimes it depends on the sport. Sometimes it depends if you're a guy or a girl. So I thought about kind of doing it the reverse, where you interview gunshot wound victims and see if they did sports when they were a kid. Unfortunately, I don't have a control group for that, but I don't know. It'd
be a tough one.
It might be a few years from now until I do it, but yeah, I don't need a control group, but it kind of helps the data.
For sure. All interesting studies, especially like when I feel like it has that practical clinical application where, you can actually affect guidelines of what you do in the emergency room, whether it's less taps, et cetera.
And it's like perfect, like ortho and sport, ortho and ER, like boom, what a marriage. I was like really happy when I thought of that. I was like, oh, you're so smart.
I'll keep an eye out for when you publish that.
Exactly. Yeah.
So for students that are trying to figure out, what specialty they want, or they just started medical school, any last piece of advice that you'd have for up and coming medical students?
Yeah. Well, first and foremost, keep your options open. Don't anchor on some specialty.
It's good advice.
Always keep your options open. You never know what you're going to like. One thing I actually didn't think of that I think would be important is that see what your third year rotations are available. What are they available to you in your school? And then see which specialties aren't available and maybe try those. So, I'm 100% love emergency medicine, but something that was like on my mind that I never had time to check out was urology. You had an option to do it during your surgical rotation, but I did cardiothoracic again, and then emergency medicine was within our surgical rotation, so I just didn't have the time. But I think you don't try out everything, but third year you're going to get a ton of different primary specialties. Just trying out stuff that's not in that year, because you can't get every specialty in 1 year. And always make sure you look at the people that you have same or like complementary personalities to, and you always gotta like the good and the bad. So you got to say, I like intubating people, I like resuscitating people, doing CPR, all this stuff, calling the shots in the code, throwing in central lines, cracking chests, putting in chest tubes, all that stuff. But you know what? I don't mind putting on my gloves and doing foreign body removal, or doing like a paracentesis, or someone is like really constipated and they just need just a quick digital rectal exam. I have no problem with that. Like, it's totally fine. So, I like the good and the bad too.
Gotcha. I think that's great advice and really good insight on the looking ahead of time about the specialties, because not all schools, and I even found this out with my school, you'll cover some of the big specialties, even like for me, it was emergency medicine. So I'm trying to get some more experience in that before I have to technically decide. So I think great advice, and really appreciate you coming on and sharing your wisdom, and looking forward to seeing where your career ends up with the sports medicine and emergency medicine.
Cool. Thanks, man. Thanks for having me.
Thank you.